Okay, let's come back to order. We're going to do a slight change in the array of stuff. We're going to do the federal funds first and not spend too much time on that. Mr. Greenman is here, and we'll do a whistle stop through that. We were going to review some of the old federal funds, and I'm not sure what he's prepared to do, but we're going to talk about the new ones for sure. So, Mr. Greenman, are you there?
Good afternoon, Mr. Chair. Dave Freeman, Budget Director with the Department of Human Services. Thanks for having me in. Happy to talk about the federal funds that the state received in the 2021 American Recovery Plan Act legislation. And we've got a PowerPoint for you to go through. So the American Recovery Plan Act, as you know, was signed into law in March of 2011. It includes funding for both state and local governments, plus additional funding for specific kinds of grant programs. And I'm mainly going to cover the grant programs today. Just as a little bit of background, it did provide about $2.6 billion in fiscal recovery funds to the state and about $2.125 billion the same kind of funding to local government units. So it included, it funds a number of grants, human services grants for state and local governments, and I'll cover those that DHS is administering at this point. You can go to the next, thanks. So the bill provides about $640 million in direct grant funding to the Department of Human Services to respond to the COVID-19 pandemic in the state. What I did is I put them into 5 separate categories: behavioral health, child care, child welfare, economic assistance, and services for older adults and vulnerable adults. And I was going to go through each category and just kind of summarize what some of the details about the funds, the program, the purpose, the amount that we received, whether we have a MOE or match requirement attached to those funds, whether we need to get LAC approval, and the period for which those funds are available. The first is the mental health block grant and the substance abuse block grant. These are both dollars that we received previously related to the pandemic. The mental health block grant can be used for comprehensive community mental health services. We received about $21.6 million. There is no MOE or LAC approval, no MOE requirement. For both of these grants, we do go through the LAC process to get the authority to spend the money. And in both cases, the funds are available until the end of federal fiscal year 25. It's a substance abuse block grant is about $20.4 million. And that's for prevention, treatment, and rehabilitation of activities for alcohol and drug abuse. The next set of grants is by far the largest pool of funds that we received in direct grants. The first is the Child Care Development Block Grant. That is the funding that we have been receiving in the past. This is the third installment of funding we received for the CCDBG dollars. The first 2 are quite a bit smaller than this amount. And what this is used for is to increase access and improve availability of childcare in the state. We received $203 million for that particular type of funding. There is an MOE requirement that the state does meet already. And we're obligated to, or we're required to obligate the funds by 9/30 of 2023. We also received funding, a sort of a sub-grant of the Child Care Development Block Grant. It's called Child Care Stabilization Fund. These are grants, these are for grants to providers very similar to what we have provided on the state level with some of our coronavirus relief funds, where we're paying providers, essentially those who had to close temporarily or those that are trying to stay open and meet public health guidelines and create safe spaces for kids. These are grants that would go to mainly to providers. There's not a lot of discretion in how these dollars are used. It's about $325 million. And again, we have the MOE requirement, and the funds are have to be spent by September 30th of 23. And then finally, we received an increase in annual funding that the state has for childcare entitlements. These are funds that often go towards things like the basic sliding fee program or other programs to provide affordable childcare for low-income families. This was about $9.2 million, and that's ongoing funding. Go to the next slide. So the next slide is child welfare funding. Again, we've received some small amounts of child welfare funding in the past related to COVID. The first is, and this is a continuation of that. The first is a community-based child abuse prevention funds. These prevent child abuse and neglect by building programs to strengthen and support families and to better understand diverse populations. This is about $4.4 million. There's no match or MOE required, and LAC approval is required for these as well. Child abuse prevention and treatment grant. These are designed to improve child protective services. We received about $1.8 million. And again, same requirements as with the community child abuse prevention grants. No MOE requirement. We have an LAC approval required, and then have to be spent by September 30th of 23. The next group of funds is economic assistance and nutrition funding. The state received pandemic emergency assistance funds. These are essentially very similar to TANF. So these are, except these are funds that we have to use for non-recurrent short-term benefits in cash or in other forms. We received about 14.4 million. There is an MOE requirement, and we are required to meet LAC, presented to the LAC for approval. We need to spend those funds by September 30th of next year. And then we received 2 allocations of SNAP grants. One is for administration that goes to state and counties. It's about 11.2 million. And again, we'll be requesting LAC approval to spend those dollars, and they're available until September 30th of 23. And also we received funding for, or we're going to be applying for funding for this last group. It's for technological improvements related to the SNAP online purchasing program. We expect to get around $500,000 for that. And then the next, we received a number of funds for older Minnesotans and vulnerable adults. Congregate meals and home delivered meals, we received about $12.3 million for those funds. There is a 15% match on those, which we already meet through our existing state spending on those services. And there's no deadline for spending those funds. And we will go through the LAC process for those. Home and community-based supportive services is another grant that we received for a variety of community-based supportive services in response to the pandemic to help older adults remain in their homes and remain living in the community. We received about 7.5 million for that. Again, there's a match that we already meet, and there's no deadline for spending those funds. There's funding for family caregivers. This includes information, respite, education, training, and support groups to support family caregivers who are family members who are caring for a vulnerable adult or an older adult. That's about 2.3 million. And again, there's no deadline on when we can spend those funds. There is a match, but we already meet that match requirement. And then the last group of grants, again, are for older Minnesotans and vulnerable adults. These include elder justice programs. So these are grants that improve interventions used to prevent elder abuse, neglect, and exploitation of older adults. It's about $2.8 million. With all of these funds, there's no match or MOE required, and we do go through the LAC approval process. And all three of the grants have ending dates of 9/30/22. The other two grants include protection of vulnerable older Americans. These are dollars that go through the Ombudsman for Long-Term Care office. It's $166,000. It's a fairly small amount. It's to help them provide services to vulnerable adults during the pandemic. And then the Aging Preventive Health Grant is for preventive health services for seniors. That's about $728,000. And so we've got about a year and a half to spend those funds. That's a very short overview of these funds. Mr. Chair, you also had some questions about some of the specific grants that we had.
Yeah, let's do this first. Let's just do it in two chunks here. So
Okay,
if that's all right, I'll keep it simpler. So,
absolutely, sure.
questions from members about the latest batch of federal grants? Gotta get my participant list up here. That's not the right one. Sorry, I'm screwing up my screen. Oh, no. Oh, no. There, that's what I want. Any questions from members? Senator Utke. Actually, a real live hand raise. I was looking for blue hands. And
Yeah, no, this is the real.
there you go.
This is the real thing, Mr. Chair. Mr. Greenman, it's just, as you went through it, we've got copies of the slides that you were referencing, but we also have copies that have the American Rescue Plan Act summary on them. And there's more things there than were on the slides, but there's nothing that references the dates that they have to be used by or they expire type thing. Is that something that's available? Just to, I mean, I like to see that when, you know, they're available until, so we know what the time periods are.
Mr. Chair, Senator Upke, we can provide that information to you. It was actually, I went into the bill language and found that information. I assumed you'd want to. I agree, it's important information for legislators to have. So I wanted to be sure you had that. So I'm happy to provide that information to you. What I have on the slides is the end date, although there are some details around the deadlines by which the state needs to commit to spending the dollars in order to continue to receive them. So there's some intermediate dates by which we need to have some plans in place for spending the money that I don't include in the slides, and I'm happy to do that as follow-up. That would be helpful.
Senator Utke.
Thank you, Mr. Chair and Mr. Greenman. Yeah, if you could, as time allows, that would be great. I would think it would be a handy tool for us as we go forward to understand what time period or timelines are connected to them. So with that, thank you.
Thanks. Other questions? I have a question, Mr. Greenman. So this is kind of some of the base stuff. And then there's this FMAP business, which is a considerable sum of money. Can you discuss that and where that shows up in any LAC, or just as if it just shows up as income to the state, or how you can describe that for us, please?
Thank you, Mr. Chair. There's several provisions in the federal bill that relate to the Medicaid program in one way or another, and some of them in particular expand Medicaid coverage. Some provide additional reimbursement to providers, and some provide additional FMAP to the state. And I think you might be referring to there's a 10% increase in the FMAP rate for home and community-based services under certain circumstances. Is that the one you're thinking of?
Please, yeah, if you could describe that.
Okay. Well, with the federal government, what the bill says is that the state will receive a 10% increase in the FMAP rate. In other words, the federal government will pick up to 10 percentage points more than it currently does in the FMAP rate for home and community-based services that are defined in the bill to include a number of the services that we normally associate it with home and community-based services like PCA, the waiver programs, the PACE program, other services that are covered by Medicaid that are considered home and community-based services. The enhanced FMAP covers a period of the period for which we get the enhanced FMAP is April 1st of 2021, so just in the next 2 or 3 weeks, through March 31st of fiscal year of 2022. There's requirements for using the funds that I think still need to be clarified and spelled out by the federal government. But the essential thing is we need to use those funds to supplement, not supplant, existing spending. And we need to use the funds to expand services, increase rates, do something beyond what we're currently doing, essentially. We need to use the federal funds for that purpose. So that there's savings that the state's going to accrue because of the enhanced FMAP. What we need to do is put that savings back into the home and community-based services system through some sort of enhancement or increase in rates or services. That's I think there's a number of things that are complicated about that law, or I should say not complicated necessarily, but unclear in terms of what they mean by supplement, some other issues that come into play as well. And there's actually a phone call tomorrow with CMS to talk a little bit more about this, or maybe it's Thursday, to talk about this provision and give the states more information about it. So we're waiting guidance from the federal government. We hope that this phone call helps to clear up some of what we need to know in order to take advantage of this opportunity, knowing that time is short at this point in the legislative session to get things done. And so we're hoping for guidance fairly quickly, and so we can move on this and evaluate whether it's the right thing for the state or not. I think, or obviously the legislators decide that. Yeah, that's what I know at this point about that.
All right, thanks. And so do you know the denomination of that? Was that the 400 million or more than that? Do you have any idea?
It's the actual specific amount is going to depend on the base period in which we have to calculate it. So we don't really know what that base period is yet. That's one of the things we want to find out from the feds. But I'd say that preliminarily, I would say we're looking at around a little more than $400 million, probably in savings on our home and community-based services that we would accrue as a result of the enhanced FMAP.
And so do we, to spend that, is that going to require legislative action, or is the governor empowered to do that as a federal fund thing if he wants?
Mr. Chair, I'm just speculating here, but I'm thinking it would be really hard for us to come up with $400 million in, it depends on what the feds decide qualifies as an enhancement or an increase, but I would guess we're going to need legislation and certainly going to want input, obviously, from the legislature on this.
Yeah, sure. And when do you expect that there's going to be, you've just given us the rudiments of the block grants and so on. At what point do you think the governor is going to give a list of what he plans to do with the money if he's allowed just to do what he wants?
Mr. Chair, I don't know. I can't speak for the governor. I don't know what the plan is from the administration. on this particular proposal, whether there's going to
And
be.
not the 400, but all the other funds, the rest.
Oh, okay. Well, we will be putting forward an LAC request in the near future to get those dollars, or I think we did actually put forward an LAC request to get those dollars spent. And we're going to be working on putting together plans right now to get those dollars, to figure out, to plan for how exactly we would spend those funds.
Yeah.
And we certainly welcome input, and we'll be doing some outreach as well to solicit ideas from stakeholders and legislators and such.
Well, thanks, Mr. Greenman. I think we're full of ideas, so we're happy to provide input. Questions from members? All right, so that's helpful for now. And Mr. Greenman, the questions I had are probably beyond just the normal math questions on those 3 different grants. But if you want to hang around and just direct me, did you get the questions, or should I repeat them?
Ms. Johnson did provide me with a list of questions, Mr. Chair.
Okay. Do you
That you're
have
looking for answers to.
go ahead. So then if you're going to head that up, then you can move into that, please.
So you had asked about, one of the funds had to do with promoting safe and stable families, about $4 million that the state received. And this was a part of the LAC request that was submitted with the governor's federal funding summary that the governor put in. And I think your question had to do with, you had a number of questions regarding the safe, stable, or the promoting safe and stable families. One was, could the funds be used for lawyers for a family's involvement in the child protection cases? And the answer is yes, they could be. It would be an allowable expense. However, by using state dollars to pay for lawyers, we're actually able to leverage Title 40 funds from the feds. We're able to get a federal match on it if we use state dollars as opposed to using these federal funds. So that's just one consideration.
That's helpful.
Yes, could use those dollars.
I have one more question about that. I don't know if you know the answer to it. So it sounds compelling, like, 20,000 families were helped. But if you divide that into the grant, it's like $200 a family. So so I don't want to belabor these. So much of this federal money to me just is money that washes in and gets spent in ways that are, in my opinion, not very carefully watched, or at least there's just so much, I can get a federal grant, we'll just give you that and you can go work on it, it seems like. But so does somebody know this topic? Tell me, like, what did they actually, so the county's got money, and tribes and nonprofits, which is kind of vague, and some grants were competitive. But what kind of help can you do for $200 a family that's going to promote safe and stable families with this money? It's about $4 million a year. Mr. Greenman, who would know
Right.
that?
Well, I can give you a little bit of background on that,
Really?
Mr. Chair. One thing I would say, your math is certainly correct. It's a lot of families with this money, and one reason why it is because our funding is coupled with funding with county dollars, and in fact, there are some case management funds in there as well. So it's the $4 million it's hard to pull it apart from the rest of the other funds, but using the combined total of the dollars that we have, which I'm not exactly sure how much that is, we were able to provide help for about 20,000 families. So the $4 million is just one piece of all the resources that are going into this program or this activity.
Right.
And it's working to, so it takes a number of strategies, grants to help families do family assessments and the response to family assessments to stabilize and support families, to support parents, and various interventions to prevent child out of placement and to keep families together and keep them stable. So those are some of the grants, mainly grants to provide supportive services to families and preventive services to families.
That's good enough for now. Then you had another, you had two more on the list, did you?
You had child or community-based child abuse prevention grants, about 2.3 million. And your question was how did it help and how do we know that it helped? Which is a good question, and one we should be able to answer. The funds are used primarily to fund parent support and outreach programs, grants, and it's to counties and to tribes. It pays for crisis services and services for families, and case management services for families also. So we've monitored the impact of these grants on families using a standardized family strengths and needs assessment model that was developed in 2019. And what we found is that about 82% of families that received the parent support and outreach funds or received assistance through those funds showed an improvement in following the receipt of those services. So we did some analysis. We did use some performance measures and used a tool that we created for the purpose, and we did find that these do have an effective or are effective in addressing the needs of families in terms of stabilization and reducing child abuse.
Thanks. Go ahead.
I was just going to say, and you also asked whether lawyers can be used for this. Probably not. These are specifically for prevention of abuse and neglect. So it's probably outside the scope of the funds to use lawyers or to fund lawyers, legal assistance. And then you asked whether the funds can be used for training. Certainly we can use the funds for both training parents and then also training providers.
All right. Thank you. And then there was one last one.
Money follows the person.
Right.
And in Minnesota, this is known as, it's money follows the person. In Minnesota, it's known as Moving Home Minnesota. So that's what we call it in Minnesota. Your question was, this was money that we received and that we requested federal funding or authority to spend. This is an ongoing program that the state has. Your question was, what did we learn and how did it affect policy direction?
Because it's a demonstration project, so I just was wondering, what did they demonstrate? Yeah, go ahead.
Right. So mainly what we did with this money is we served people who were looking to move from nursing facilities back to community-based living. And in a very high level, that's essentially what we use the funds for. So what we did is as you said, it's a demonstration program, and we sort of looked at 5 different services that were that over time actually have been incorporated into state plan or waiver services. Some of those include certified peer specialist services, other services that relate to moving people from a nursing home back to their housing stabilization, those kinds of services that enable somebody to make a transition back to independent living or semi-independent living. So we receive an additional 25% federal match on people that we serve in this program. And so what we did is we put that money back into additional services and have been successful in moving people out of nursing homes back into home and community-based services.
All right. So it was 12 million in 2020, and then 6 million, and then $1 million a year in 22 and 23. So is there state money that's going with this to continue this, or is that the end of it then, do you know?
Mr. Chair, I believe there is some state money that goes into this that helps to draw down the federal funds. I'd have to look to see what exactly the base appropriation is for it, but yes, there is state money.
Yeah, because I mean, it starts out big and then goes to little, which is kind of novel, so yeah, I'm curious not for you, but somebody can let me know what the status of that, just what we're doing. It seems like it's a good idea, but, we get so far removed from these federal grants. Any questions from members? And so, Mr. Greenman, if I did request all this information, and in terms of this batch of federal grants, the batch we just talked about, not the American Rescue Plan, then I'll put it in writing, but I've had ample information to satisfy my curiosity and my need to know. So we'll put that in writing so you can have those back. So thank you, Mr. Greenman.
Thank you, Mr. Chair.
And I think that we're probably done with you for the night. We're going to be talking about some more fun things. You're always welcome to pop in whenever you like. But thank you very much.
Mr. Chair.
Thanks. Senator Bingham,
How are you, Mr. Chair?
welcome back. It's like you never
Thank you.
left.
I think it's the third time on this bill, so I appreciate the committee's time and effort and diligence.
Yeah, it's good to have you here. So do you have some, I presume you have some comments. So Senator
I do.
Hoffman will move Senate File 1063 to be before us. And the floor is yours, Senator.
And I also have the A11 amendment. This is, I can go through the amendment because it's not obviously the original stop. So I'm no problem doing that, but I just need somebody to move the A11.
Yeah, before we do that, would you just kind of
Oh.
describe what you've been doing since we last saw you and
yeah.
dialogues you've been having and, all
Yes,
that? Thank you.
I know that the department, thank you, Mr. Chair. I know that the department, NAMI, Aspire, and the counties have all been in numerous discussions over kind of making this bill get at what we want to do for Family First implementation, but also understanding that the long game is to make sure we have more resources available for youth mental health programming. And really, we've got some good changes here and a lot of good agreement. And I just don't know that this bill will ever stop moving, Mr. Chair. I think it's just one of those things that's going to continue to need to have discussions. But more importantly, I think we definitely have peace in the valley to continue to move forward. And really appreciate everybody's time that has gone into this to make it even a better bill. And, maybe I can reiterate this at the end, but I just want to say that I think, Family First is a federal program. It was something that was sent down to us. We have to adapt to it. Otherwise, it's a huge unfunded mandate. Do I still think there's going to be some unfunded mandates for my county friends? Yep. I'd be lying if I didn't say that. And do I think we're going to continue to have more demand than supply for this type of housing QRTP? Yep, I do. But we need to do this, and we need to continue to implement these changes and continue to meet that need, and to continue to increase the amount of mental health programming we have for our youth, and continue to try and meet that demand. But I just kind of want to manage expectations, Mr. Chair.
Well, I'm not going to let you lower them very much, so we're going to we're trying to get the best bill we can out of the Senate.
Yes.
And I hope the people in the community, which includes a whole bunch of individuals, the families themselves, the department, the advocates, did I say counties?
Yes.
And the state at large, I think we want to make this as good as it can be, and I think we're on our way to that. So
Absolutely.
Senator Hoffman moves to A11. Do you want to describe it, please, Senator Bingham? You want staff?
Yep.
Yeah.
I can, and then Ms. Sommerfeld can correct me if I mess anything up. So really, there's a lot of technical changes in this amendment. It really does some 2060 adjustments, meaning, and this was something NAMI had sought, which was ensures that parents have control over which relatives are included during the relative search for volunteer placements that are under 26D. It inserts language that the counties would like, that creates a rate of payment for foster care residents using the basic monthly rate provided in statute, and that's going to be revised every April, and that's in accordance to the USDA's estimate for cost of raising a child. And then there is language in there that Aspire wanted about development of aftercare policies that will fall with DHS. And I think I've gotten everything. If Ms. Summerfield wants to correct me on anything, but I think I've hit all the high notes, Mr. Chair, but I would ask if I missed anything.
Thanks, Ms. Summerfeld, and be happy if you want to correct Senator Bingham, that'd be just fine with me, so. Well, she actually requested it, so. Ms. Summerfeld, welcome back to the committee.
Just let the record know I didn't ask for Senator Hoffman to correct me, so.
Thank you, Senator.
Well, and I'm not going to correct her either. Thank you, Mr. Chair, members of the committee. I'm Jennifer Summerfield with DHS, and I think Senator Bingham did a fine job of summarizing.
Thank you. Thank you. So with that, Mr. Chair, you know, we can answer any questions. I don't know if there's Mr. Freeman wants to say anything. Christine from Aspire, NAMI.
Well, we do have 4 testifiers signed up, and there's a bunch of amendments that I'm intending to adopt everything, just so we can get a good fiscal note and see what we can afford to do. So, Senator Bingham, would you think we should adopt the amendments first and let people testify to the bill as it's amended? That might be more sensible, right?
Yes, I do. I would like to spend a second talking about your A4 amendment or whatever number it is.
Well, let's just do one at a time. So we're on the A11. So let's adopt what we can adopt, and we can leave some things open if there's just a lot of questions. If there's like only one we want to question, we can listen to testimony and then decide. So
Yeah.
any questions of the A11? Seeing none, all in favor, say aye. Aye.
Aye.
Opposed? It's adopted. So Senator Bingham, which one do you want next?
That's up to you, because that was mine. I put mine in one large amendment for brevity,
Right.
because time is of the essence and time is money. We know this, so.
When it comes to human services, time is nothing. So Senator Hoffman moves to A12. You want to describe it, Senator Hoffman?
Mr. Chair and members, these were the discussions that have been in place. You're going to have the 12, the 9, and the 10. And if Senator, if you would, if Liam wants to explain how this one fits this is absolutely on the certification cost side of it, especially when it comes to the 4E funding. I don't know if Mr. Liam wants to explain this more.
Or we can call Mr. Monahan, but whatever you like.
Mr. Monahan, did I say Mr. Liam? Sorry, it's
It's
late.
been a long day. Mr. Monahan, do you want to comment on this, please?
Jeez.
Mr. Chair and members, to be quite honest, I don't remember where this one came from.
Mr. Chair.
Senator
I can
Bingham,
help.
thank you.
Yeah, thank you. And I have to say, Mr. Monahan is a rock star. I mean, working day and night, weekend, oh my gosh. So just thank you, Mr. Monahan, with all that, and all the stakeholders and emails, and anyway. So I think this came from Aspire, and maybe Ms. Anderson wants to speak to it, but look, essentially they want to know, how much is this going to cost our providers, the QRTP providers? And it asked the department to put together a study that really relates to the cost to become a provider. And my concern is, we already know that this is going to be costly, and this is going to be costly to the counties. And we are probably going to have to look at rates. But I just worry that we don't have any funding to the department yet on doing this study. And I don't want to speak for them, but I would assume they don't have the expertise. And I probably should have said something before to the department, but I
Senator
was.
Bingham, they have expertise beyond your wildest imagination.
Well,
Maybe let's Ms. Summerfeld, you can just do this, can't you? Like on a
Well, and
weekend or
then-
something?
there is no effective date on it, I noticed, and that's concerning too. So I don't know. Maybe it needs a little bit more work. So maybe that's something next week we can work on. But Ms.
Senator
Summerfield.
Begum, let me just explain to you and to the public.
Yeah.
It's my intention to put as many ideas into this bill that can run into the process, so they can all be
Yeah.
considered. And so as we refine them, we can improve effective dates and so on. But,
Okay.
and this is actually, we're looking for ideas that are in writing. And so,
Yeah.
Ms. Summerfeld, can you describe how hard this is going to be to do?
Mr. Chair, members of the committee, I don't know if I could say how difficult it's going to be, but I do know we do not have staff that will be able to do this. This is something that we would probably hire out to a consultant to take care of this work.
I think I want to come back as a consultant. I think that's what I want to do. Anyway, so let's, and so have you offered any technical assistance on this yet, Ms. Summerfeld?
We have not. We just saw the amendment today, I believe, but I have had conversations with Ms. Anderson to let her know that we would probably need to provide some technical assistance on the language.
And so
And
if
I
you
think
could
we-
make it as simple as it can be, the question is, what's it going to cost? And it seems like that's a question that your department should answer ordinarily. So the better we can ask the question to be more succinct, the less you have to hire somebody who's from out of town to figure this out. So, is that right? Or should I just, yeah, thanks. So, anybody else want to ask about this? Mr. Freeman, I see a hand there.
Thank you, Chair Abler. Matt Freeman with MAXA, Minnesota Association of County Social Service Administrators. I guess I would echo what Senator Bingham had raised. We do expect there to be significant costs for counties as well for the implementation of Family First and to the state as a whole. And so if we're looking at calculating that, I think it's really important that we look at the full picture and those cost implications and can have an honest conversation about the impacts. I think we know that the changes from this federal law are going to impact access to some federal funds and change how licensure happens and a variety of things. And so I think if we're going about pulling that together, we'd be interested from a county perspective in calculating those impacts for counties too.
So,
Mr. Chair.
Mr. Freeman, so you're suggesting that we add counties and the state into that mix as well? Is that what you're suggesting? Is that what you said, the two? You had two?
Yeah. Yeah, Mr. Chair, I think from conversations about the impact of this legislation, I think looking at just providers, I think I can recognize there are challenges there, but I think we also need to look at the kind of impacts across the full system to get us the right information and to be able to assess the costs and impacts.
And that might include families as well. So, so this is actually a real hearing. We're actually working here, figuring things out. So, Senator Hoffman, are you bringing this? Are you working on this?
Mr. Chair, no, that's, Senator Bingham has been working on this.
I mean, this amendment, you brought this, but you're just being a nice guy.
I have the amendments lined up that are ready to go for your committee here, and I was just gonna, and the next one, then, actually,
Being a
Mr.
good guy.
Monahan is gonna explain how
All
the
right.
A9
So here's,
fits into
Senator Bingham, here's what I think. I think we're going to put the amendment on, just so
Okay.
it's there. And then if you would go work with the department, I think, because you're curious what things cost anyway.
Yeah, and Mr. Chair, my whole point is, I think what we want to know, and I see Ms. Anderson turned her camera on, but I think what we want to know is, well, if it's too costly to become a QRTP license certification, then, and people decide not to do it, well, then what? Then we're going to be right back here. So, I mean, I don't think the information is bad, but I really think we need to flush out this language, and it was kind of sprung. And so I would be more than happy to work with Mr. Freeman, Ms. Anderson, and the department to clean up Senator Hoffman's amendment.
Yeah, he doesn't always do very good work, does he? Senator Hoffman's amendment, that's funny. Actually, he does some very good work. Ms. Anderson, were you trying to say something?
Mr. Chair, members, yes, I would just concur that we have had many conversations about a whole host of items in this Family First package, one of them being the importance of having some public policy transparency around what are the costs that are associated throughout our system. And to Mr. Freeman and Senator Biggin's comments, I would say absolutely yes, that we need to fully understand. So then as a matter of public policy, we can be clear about how it is that we seek to capture those costs creatively and practically. And so would agree and glad to work with anybody on improving this.
So there you go. This is going to be a committee effort. It just seems, just my editorial, it seems to me that this is something the department should provide us with. You have Mr. Greenman, who by himself could probably put this together, but he has other people. You have a MMB group, you have all these EBO people running around and experts and maybe if, Ms. Sommerfeld, if you use the word ballpark, that'll make it a lot cheaper to figure out. But I think that we don't know at all what it's going to cost. And I think we do want to know, and then we have to decide if we're going to pay for it. But so anyway, I think we beat this up well enough. So Mr. Monahan, I know you're listening. So the department will provide you some simplification language. And we're going to be talking to counties and state, and we should even see if the families are on the hook where they weren't on the hook before. Is it going to be a barrier to people coming in? And the very thing we want to not do is create another donut hole. That was the end of our last hearing. There was this gap, and we don't want a gap if we can avoid it. And if there's a gap, we want to know and say, we're sorry there's a gap. So I think we beat that up well enough. Any more questions on the 812? And Senator Hoffman renews his motion that the nearly ready for prime time amendment be adopted. All in favor, say aye.
Aye.
Aye. Opposed? Senator Bingham, more homework. Senator Hoffman.
Mr. Chair and members, the next amendment is the A9 amendment, and absolutely I'm going to need Mr. Monahan to explain how the A9 goes to the original amendment that we had, which is the A11. And if I got that right, Mr. Chair, there's
Mr. Monahan.
the A9.
Mr. Chair, members, I believe the motion is actually to adopt the A10. A9 was produced for the purposes of public disclosure so that members who wanted to delve in could see how this amendment changes the underlying bill. But given the extent of the changes to Section 1, Article 1, Section 1, I thought it more prudent to provide the committee with the amendment in the form of deleting Section 1 and then reinserting what is essentially an engrossment of the amendment that is sought and the remaining language that is unamended in the bill.
So Mr. Monahan, you recommending the A9 or the A10?
The A10.
Okay, so the A10 is the non-engrossed version. A9
Oh,
deletes
I'm
section.
sorry. Oh, my goodness.
Yes. Okay.
Thanks. I don't know, be nice, he hasn't slept for days, so.
Yes, for sure.
So Senator Hoffman moves to A9. So Senator Bingham, do you want to tell us what we're doing, or is this, should we have somebody else? Oh, that's it?
Yeah, I would have, I really don't know what Senator Abler's amendment does. I think part of it, Mr. Monahan, that I incorporated in my, part of my amendment, or am I getting that part wrong? I know that this might be something that NAMI suggested.
Let's bring them up to the, bring them up to the table, which no one's coming to the
Mr.
table.
Chair, could I
Miss
make one-
Senator, Mr., whoever you are, Mr. Monahan.
I just want the committee to recognize that if you, the committee, adopts the A9, you're actually going to be undoing a very small portion of, what was it? Senator Bingham's
Yeah, my original amendment.
A11.
Yeah, so we can't do that, Mr. Chair, because that will tick off the counties.
It would be undoing lines 1.2 to 1.3,
Yeah,
Because what this amendment does is actually delete the language that those two lines amended.
yeah, and it's
Just
very
so you're
rude of
aware of
Senator
that.
Hoffman to do that without consulting me, by the way.
That's just how it goes sometimes. So what's your recommendation, Mr. Monahan?
Well, if the bill is staying here in committee,
It's staying here in committee.
then I would suggest that the motion include an instruction to staff to reconcile the amendment, giving priority to the A9.
11.
11, the priority to
A11.
the A11 amendment.
That seems like a good plan. So Ms. Abder-Holden, can you just tell us what the base of this is? And we'll deal with the technical stuff. And so, Mr. Monahan, it's really a technical glitch, not an intentional undoing Senator Bigham's fine work.
Hang on. Mr. Chair and members, the two amendments are, in this respect, incompatible. If you adopt the A9, but insist on keeping the changes to, that were in the A11,
11.
you're going to undermine the entire intent of the A9.
Okay, then. We'll talk about that some more. Ms. Abder-Holden, we just need to hear some advice from you. So welcome. And actually, I think the committee is facing some of the challenges of weaving together all the interests. At the end, we have to find a way to resolve the most interests we possibly can. And so, Ms. Abder-Holden, thank you for your work.
Thank you, Mr. Chairman, members. Sue Abder-Holden, Executive Director of NAMI, Minnesota. So I had alluded to this earlier, but I think we finally figured out a way to do this. So if a child is going into child protection, they will go through 260C, the Child Protection Act. If they want a voluntary placement, then they would go through 260D. And as you know, what we were trying to find is that third path. So for families who have a child with a mental illness who are going into residential treatment, where they didn't have to do, for example, the relative search and those expanded teams. And what I realized one night is that 245, the Children's Mental Health Act, has that path. But what we've done over the last, couple of years is we have done circular references for all three of the acts. And we wanted to make sure that counties who are paying for the residential treatment, so if they're not using $40 or anything like that, that they continue to have a say in terms of what happens, because it's their money. So what we essentially do in this amendment is take out the references to 260D and C and D, where we don't need to, right? And keep it clean. I added some things in there that the counties had wanted. For example, the 6-month review of the out-of-home placement of the residential treatment. So it really is in some ways just cleaning up the path that we already had and didn't realize. We have not, I'm going to be perfectly honest, we have not gotten the feedback yet from the counties on this, but it really is, a lot of this is existing language. It's just that we're not kind of doing those circular references back to 260C in particular. It does not prevent a child in child protection from accessing the Children's Mental Health Act, but otherwise there's no reason to tie in all the child protection language into 245. We're going to keep it clean and keep it focused on kids with mental illnesses who need residential treatment. That's kind of the big picture. I hope that makes sense.
It helps a lot. Ms. Sommerfeld, you must have a thought about this.
Mr. Chair, members, I actually do not have any thoughts on this one right now. I think I would refer to Matt Burdick if we have a comment on this.
Ms. Burdick, Mr. Burdick, we haven't seen you all day. Welcome.
Thank you, Mr. Chair. For the record, Matt Burdick with the Department of Human Services. We have been taking a look at this concept and definitely understand what the proponents are trying to do here, and we're just going to continue to work out some of the finer details, but understand the direction this is going. We just have to spend a little bit more time looking at all the various moving pieces here.
Okay, so Senator Bingham, the intention of the A9 is to do no harm to what you're trying to do.
Yeah, Mr. Chair, I would recommend what Mr. Monahan said, which is to put this out there for public disclosure and then continue to work on it for the discussion to fine tune it. I think that's what he was saying. I could be wrong, but I think I don't disagree with what Ms. Aberholden is doing, and I just think we gotta make sure the language meets what they're trying to do, and I think the counties and the department need a second to do that, with working with her to fine tune those words.
Yeah, I get that. Mr. Monahan, if we adopted the A9 and told you to sort it out and it's unsortable, this is going to be this is going to be taken up the next time on the omnibus. There'll be, and you understand the intention of me and you and everybody, but I think there's enough content that's necessary in the A9 that we're going to want to capture. And with the technical work to make sure that we don't do harm to what your intent is, Senator. Mr. Monahan, is that a compatible direction to go in?
I'm not quite sure I understood the direction, but let me just offer one thought. If we look at the A9 at page 4, line 8, that's the only place where the two amendments are incompatible, strictly speaking.
Yeah.
The A9, or I'm sorry, the A11 amended the very end of that line by adding 260D, so that it read in chapters 260C and 260D. This amendment, because it's trying to strike all those cross-references back to 260C and 260D, deletes that language. So as a purely technical matter, that's the only place they conflict.
So, Mr. Monahan, if we just didn't adopt 4.8 on the A9 and had the got rid of the and or something, but that kind of gets us where you want to go for now. All the ideas are there and they need maybe some cleaning up as we go through the process. This thing has a month to work on it yet. So does that seem reasonable to you?
Well, I can see Sue wants to jump in here, so perhaps.
I have some more
defer
testifiers
to
too.
her.
So, Ms. Aberholden, why don't you go, then I'm going to talk to Mr. Freeman.
Mr. Chairman, I just wanted to say that on that line, on 4.8 and 4.9, what we did instead is say that when the county does that level of care determination on 245, we actually amended 260C instead of adding 260C on that line. So we still kept the concept, we just moved it back into child protection instead of, again, referencing child protection in 245. So we kept the concept, we just moved it.
Yeah, that's correct. The same concept appears in the amendment on 4.12 to 4.13.
And so, Mr. Monahan, the A11 reference is page 3, line 20, where it says insert and 260D. Is that what you're talking about? Is that where they conflict?
Right, page
Okay.
1, lines 2 and 3.
Yeah. Okay.
So if you wanted to do it in the really literal technical sense, you would reconsider the motion by which the A11 was adopted, and you would strike those lines. Or you can just tell me to do it.
I'm inclined to tell you to do it, because that's the nature of our discussions. But first, let's talk to Mr. Freeman, and then Senator Nelson.
Mr. Chair, Matt Freeman with Maxa. I would just echo what Sue had said, that we have had some productive conversations. I think we're scheduled to sit down and talk further later this week on Thursday to the content of the bill, and we hope to be able to find common ground there. I think from a county perspective, we understand the advocates' concern about some of the requirements for Family First. At the same time, we have concerns about ensuring that in particular, folks don't languish in care, that they're finding the appropriate level of care. We've raised some of those to Ms. Abderholden and continue to be committed to making sure that some of those protections and some of those processes are still a part of the overall placement process. So we're committed to continuing to work on that. I unfortunately don't have expert phone a friend from our counties on this topic here with me today, as we didn't know this was going to be added to the agenda, but we'll continue to engage in those conversations and to flag that we have concerns, but we're committed to finding common ground.
Senator Nelson, do you have some helpful advice?
Thank you. Now, Mr. Chair, I just have a few words of gratitude for for Maxa, for NAMI, for Sue Abderholden, working together to really get to the point that we accomplish what we had intended regarding children being able to get a residential treatment in a timely manner, but without needing to go through child protection. I think that is the gist of this amendment. I think that was the gist of one of the bills I had in your committee last week. And I'm just thankful that these discussions are continuing. Even though they're tedious, I think it's critically important when we're talking about children getting mental health care early when they need residential treatment without being put through that child protection door. So thank you for your work on that.
Yeah, thanks. We actually really are doing committee work tonight. Ms. Abderholden, if we just took out paragraph G on 4.7 to 4.9 altogether and adopted the rest of the amendment, I think that keeps you in the discussion loop. I think it gives you the benefit of, you know, a little bit of this side, a little bit of that side, and knowing we have to have a resolution. Is that acceptable for tonight? That's what I'd like to do.
I mean, I guess I have to say yes.
No,
although
you don't
I
have to say anything. No, I just mean, it doesn't, I mean, there's a lot of other good stuff in the amendment that you,
Right.
at least that way you
And
button that down.
I mean, I don't think that's the issue with the counties, to be honest. I mean, I think, and even with the department, they thought that language was fine because we replaced it on 4.12 and 4.13. But if you think we need to take that out to move it ahead, I will just keep it in my brain and we'll bring it to our meeting on Thursday.
I think that's kind of keeps us, I don't really feel like changing the A11 just because that's been sorted through and there's some agreement on that, except for that I think it's really smart that we're going to clarify what 260CD and 245 do. And this will force that discussion to happen, I think. So is that fair with you, Senator Begum?
Yes, exactly what I'm thinking too. And I think that this was a good discussion on that, and moving that around is probably the best thing we can do.
So Senator Hoffman renews his motion to adopt all the A9 except for lines 4.7, 4.8, and 4.9. Everybody understand that? Any other questions from members? Don't think so. All in favor, say aye.
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 Opposed? That's pretty good. Well, we have testimony. So, to the bill as amended, Ms. Anderson. You want any more amendments tonight, or is that enough?
Mr. Chair and members, that's all I have, and I think that should do it. It should get you into the package that's workable, and it sounds like folks are willing to work, Mr. Chair.
Okay. Ms. Anderson, welcome to the committee.
Mr. Chair, members of the committee, my name is Kirsten Anderson, and I'm the Executive Director of Aspire Minnesota, a statewide association of children's service providers. We're grateful for the opportunity to be with you this evening, and we'll keep our comments quite brief. We are grateful for all the discussion within the committee and with stakeholders, including the department, Maxa, NAMI, and others who have contributed. Thank you all very much. Just a quick word about a couple of these items. One is the A9, as has been discussed, is truly an inspiring stride forward for our mental health system, giving us the opportunity to really care for children with mental illness from a mental health care perspective, and really also to take into consideration some of what philosophically has driven the federal government to create Family First to begin with. Assumptions that we have from a child protection standpoint that don't always align well with our needs to provide mental health treatment, mental health care, and ultimately the parity we all want for kids and families. So deeply grateful for that work to continue forward. Just a comment about the A11 as it relates to aftercare support. That has been a deeply needed service that has been missing from our service delivery to date. And we are really committed and hopeful about developing a plan that can deliver aftercare to children 6 months after leaving residential treatment as they reintegrate into community life, receive the ongoing support that they need, and become part of that community and family life once again. We already talked about the A12 quite a bit. And so grateful for all of this work and to continue to do the work together to improve Family First Prevention Services Act for the state of Minnesota. One issue does remain under discussion, I just wanted to briefly mention, which is services for children who are currently in family foster care license corporate foster care settings. We look forward to delving more deeply into this service with our DHS and county partners to assure children in this unique setting can continue to access needed care. So again, thank you to Senator Bigham and the whole committee, and we look forward to continue to work on this important bill.
So, Ms. Anderson, we're getting there, right?
Sure.
Thanks. All righty, thanks. Mr. Freeman, do you want to take another bite here? Welcome. Glad you're here.
Thank you, Chair Abler. Matt Freeman with MAXA. Thanks again for all the work on this bill. MAXA overall supports this bill codifying necessary language for federal FFPSA implementation, and really appreciate the work that legislators, stakeholders, and DHS have done, particularly on some of the amendments today. We support the work going on and continue to be committed to improving this as it goes forward in the process. I'll keep my comments short. I would actually turn it over to Brenda Carlson, one of our members, to give a little bit of additional insight on the A6, or originally was the A6 and then became part of the A11 amendment, if that suits the chair.
That would suit me fine. Ms. Carlson, welcome to the committee.
Thank you and good evening, Chair Abler and members of the committee. As Matt said, my name is Brenda Carlson and I'm a supervisor for children's mental health, the family school support worker and parent support outreach programs at Carleton County Public Health and Human Services. I'm also testifying on behalf of MAXA. I have been a supervisor for 20 years, 14 years as a child protection supervisor, and 6 as a child welfare and children's mental health supervisor. And prior to that, I was a disability case manager and child welfare social worker for 14 years. So I have 34 years of experience in the child welfare practice. And I want to thank you for this opportunity. Today, I'm going to be talking about the former A6 amendment concerning the children's corporate foster care contracting component. So prior to the Families First Prevention Services implementation, the room and board costs paid by counties for children placed in corporate foster care settings was based on the state MAPC assessment, or the Minnesota Assessment of Parenting for Children and Youth. And that rate is based on the age of the child, and it's set in statute and is indexed to federal cost factors. The room and board rate is a small portion of the daily cost for the corporate foster care placement, most of which is covered by the child's disability services waiver, as their care costs are related to their disability. And so the Families First Prevention Services Act causes a change in the designation for children's corporate foster care facilities, resulting in the MAPC no longer determining that room and board rate for these facilities come October of 2021. In effect, this would have counties negotiating a room and board rate with each of the more than 150 plus programs across the state. Having counties engage in contract negotiations on room and board rates, location by location, could create inconsistencies in room and board rates and adds administrative burdens to counties. Thus, the amendment sets the room and board rate statewide, tying it to the MAPC basic care rate already in statute, and that adjusts based on federal costs. This uniform basic monthly rate continues our current practice, is simple, consistent, and fair. We would appreciate your support of this, and I thank you for your time, and I'm willing to answer any questions.
Well, thank you very much, and appreciate you being here with us. Ms. Aberholden, do you want to say something else?
Thank you, Mr. Chairman, members. I just want to say thank you. This has been, as you know, a very difficult bill for NAMI last year and this year. And I appreciate the department and others willing to meet quite a few Saturdays in a row. Not always fun meetings, but I think we grew to kind of understand where each of us were coming from and try to figure out how we can address people's major concerns. I think that when you have a bill before you that everyone is kind of okay with but not loving, you've reached some good compromises. And so, again, I appreciate everyone's work on this. I know we've got a little bit left to do, but I think we are getting closer to having basic agreement on how to move forward. So, thank you.
Well, and thanks, and that's all the testifiers I see. I think it's really important that all the voices get recognized in this kind of a sweeping change, and I just want to thank everybody who's been a part of it, the department, with Ms. Sommerfeld and her crew. There's many more people behind the scenes than her, I know, and then the others that were here. If people watch, they think we just argue all the time, and actually this is where we dig in and try to solve things, so. It's not quite there yet. Senator Begum, you've been remarkable. It's like you never left the committee, so you're here as an honorary member. We'll have to have you come back, and actually there will be an amendment probably on April 8th that you'll need to bring to us, so we'll have you back one more time.
Happy to do that. And again, I just really appreciate the committee's diligence on this and patience on it. So it's an important topic. It's not one that we wished upon ourselves, but I tell you what, I think with all the hard work from all the stakeholders, it's going to be a damn good product, and it's going to help kids. It's going to have them get the services that they need, and so and really be a tool for families for reunification. So it really is a lot of gratitude goes to the stakeholders in the department and the counties.
Yeah, thank you, and I hope that when the fiscal notes all get the dust settles, I hope that we can afford it. It seems like it's turning into quite a good package. So. Any other comments from members? All right, so we'll lay it over. Thank you very much, everybody. The governor's budget. That's the last item on the agenda. So, who's the lucky presenter? I got a list here. Oh, Commissioner. How about that? I forgot you were coming. Thanks. Nice to have you here. Just hope you noticed the good news about something being worked out on with your department about this whole Family First thing. It's turning into a success story. So, are you there? Hello.
I am, and I absolutely noticed that. I want to thank all the constituents that helped us to work on this to get to this point. This was a federal bill that came to us with plenty of barnacles attached to it from the federal government. We've been working to try to implement it in Minnesota the best way possible, and we appreciate everyone who's worked on it.
So go ahead. So are you leading the discussion?
Yes, thank you, Chair Abler and committee members. Thank you for the opportunity to share the proposals from Governor Walz's supplemental budget as they affect human services. Today, you'll also be hearing from our assistant commissioners who will walk through the proposals from their areas that are new or have been changed since we last presented to the committee. The governor's supplemental budget proposals for human services build on the priorities laid out in January. This includes targeted investments to support the agency's mission, measures that reinforce process controls, and efforts to help Minnesota recover from COVID. We don't want to just get back to normal. We aim to get back to better. While we're encouraged by recent progress fighting COVID, there's no question the burden of the pandemic and its economic fallout have been significant for low-income Minnesotans. Consider that over the past 12 months, the Minnesota Family Investment Program cases are up 18%, or nearly 5,000 families. Minnesota healthcare programs, Medicaid, and Minnesota Care enrollment is up 11%, or 75,866 enrollees. And our Supplemental Nutrition Assistance Program, also known as SNAP, enrollment is up 11%, or 21,646 families and individuals who need assistance. In the face of this need, we are grateful for the improved economic outlook for the states. This has allowed us to remove some of the more difficult cuts we made in January and make some key investments to help ensure an equitable recovery, all while making sure we are crossing our Ts and dotting our Is. Our proposals are based in part on listening we've been doing in the communities that we serve. I'm especially proud of our proposal to maintain family connections in foster care, which are informed by discussions with the community. I'm also pleased that we're able to do more for children and their families living in deep poverty. That is a family of 4 with an income of no more than $905 a month. The governor's supplemental budget funds an annual cost of living adjustment for the Minnesota Family Investment Program. A COLA will put in motion an automatic increase that will continue to incrementally improve the well-being of children in deep poverty, so we don't have to wait another 35 years to get an increase. Taking a look at some of our overall proposals that are in the governor's supplemental budget. First is the repayment of tribal MAT and county IMD overpayments. As you know, between fiscal 2014 and 2019, DHS paid the Leech Lake Band of Ojibwe and the White Earth Band of Chippewa an incorrect rate for clients taking medication at home instead of in a facility. From January 2014 to May 2019, DHS incorrectly claimed federal funding for some substance use disorder programs. This proposal holds counties harmless for their share of those overpayments, which would be a cost of $37.2 million. Our DCT operating adjustment has been traveling with us all through 2020, and it's still here today, though it has come down some since you saw it last. The investment now, $49.9 million to provide an operating increase to cover the full cost of care for patients and clients in state-operated treatment facilities. It increases the base appropriation by about 9% for the biennium, necessary to avoid cuts in services and to maintain our staff. As I mentioned in opening comments, our aim is not to get back to normal, but to get back to better. We've had lots of conversations, especially with our chairs, about things that we can do to come out of COVID in a way that keeps our state services running smoothly, provides the least effort for counties and tribal partners, and makes accessing services as simple as possible for the beneficiaries across the state of Minnesota. I'd like to turn it over to our Inspector General, Kalani Moti, to describe some of this plan.
Ms. Moti, welcome back.
Thank you, Mr. Chair and the city. My name is Kalani Moti, and I serve as the Inspector General here at DHS. And are returning back to better and returning from COVID emergency measures in regards to our background studies. As you know, the background study requirement was modified to allow providers to quickly respond to their changing workforce needs, including waiving the requirements for fingerprint-based background studies for most categories and instituting a Minnesota-only background study using an individual's name and date of birth for maltreatment and criminal history for most provider types. There are some challenges in returning to our standard background studies. Currently, there are over 135,000 modified or emergency studies, and that number continues to grow as long as we are in the peak time emergency. After the emergency, all study subjects are going to require fingerprint background studies, and the 60-day transition time frame, which is currently in statute, is no longer sufficient. So what we are proposing to address the transition time and cost is to extend the transition time to 365 days. It would add temporary FTEs to handle increased volume of studies, and it would provide the credit for a previous emergency study and then covers any resubmission costs for our studies that are conducted under an interagency agreement on that. And so our total cost would be about $7.7 million with 9 FTEs on that. And at this point, I believe turning it over to Lisa Bailey.
Thank you, and thanks for being here 3 times today. Ms. Bailey, welcome.
I'm sorry, this is Lisa Bailey. I'm the Acting Assistant Commissioner for Children and Family Services. And I think Ms. Moti maybe has one more slide to address, or we can move forward past that, the Economic Assistance Program. And I can just address that.
Go ahead.
The proposal, this proposal would add $3.6 million to concentrate on the cash assistance recertifications, deferring the federal SNAP recertifications and concentrating on the MFIP and other cash assistance recertifications in order to streamline and smooth out all of the recertification process, which would create an even workload for county and tribal human service agencies. And that would require 3 FTEs and $3.6 million, as I stated. Next slide, please. This proposal is for investments from the general fund and the TANF fund to provide cost of living adjustments for cash assistance provided by MFIP payments. MFIP, or Minnesota Family Investment Program, provides deep poverty level benefits. The current MFIP payment is $632 for a family of 3, well below the deep poverty line, and is a little more than half of what it takes to rent a 2-bedroom apartment at fair market value in the Twin Cities. Providing assistance closer to the costs of housing and basic needs helps families stabilize and move out of the crisis that drove them to MFIP in the first place. As the commissioner noted, in the last 35 years, cash assistance has been increased 1 time in 2019 by $100. And I'll note that federal income support programs such as Social Security and SSI and SNAP all make annual cost of living adjustments. Next slide, please. Our next proposal targets family prevention, reunification, and permanency. Racial and ethnic disparities have persisted in the Minnesota child welfare system for decades and are seen at every major decision point in the system. These proposed changes will help address these disparities by connecting children with families and supporting an already stressed system. The proposal makes background study requirements for child foster care licensing similar to what is required for adoptions. They're now different, leading to disparities. It also clarifies agency requirements for finding and considering relatives for placement when children are in foster care, and provides more training and support to county and private agency foster care licensors. Finally, it provides additional staff for the licensing division to meet an increased workload, reducing waiting times in an already lengthy process. Next slide, please. And the Family First Prevention Services Act, which we've already heard quite a bit about, requires significant changes to the state child welfare system with the goal of reducing the number of children in out-of-home care and the length of time they spend there. The department is using available federal funds to offset a portion of the cost of making those changes, and including adding some staff. This proposal continues that implementation work so that counties are able to comply with 4E requirements and draw down reimbursements for child welfare activities. It is essential that these implementation needs are addressed during the session in order to meet the October 1st deadline for conformity and give adequate time for preparation for future compliance. The state is ensuring that child residential facilities meet the new federal standards by having DHS review and approve new certifications for licensed service providers. We've already talked about that, the QRTPs. Legislation enacted in 2019 and 2020 provided the resources and statutory changes we needed to begin developing the state infrastructure for residential prevention services. This proposal continues to prepare the state for implementation to reduce the risk of a disruption. It has licensing FTEs and some staff for implementation of those prevention services. With that, Mr. Chair, I would like to turn it over to my colleague, Gertrude Matemba-Matassa.
Welcome to the committee, Ms. Matemba-Matassa. I haven't seen you for a while either. Nice to have you back.
It's good to see you too. Mr. Chair and members, thank you for the opportunity to be here today. I just have a few items, starting with the PCA program. So the PCA program is an essential program for the people of Minnesota. PCAs provide over 44,000 Minnesotans with the option to receive services in their homes, and they essentially keep people out of costly institutional care. In January of 2021, the SEIU negotiated and entered into a contract with the state. This proposal funds the obligations to SEIU represented union workers as specified in this contract. The contract includes wage increases, paid time off, and also provides training grants in both the 22-23 and 24-25 biennia. It's important to note that these increases impact all PCA rates, not just union employees. The changes proposed here, the main change proposed here is to now include cost reporting for PCA and community first support services. Cost reporting is important because it will support data-driven improvements to future rate setting. Cost reporting provides a consistent basis for the commissioner to determine whether the rate paid to providers adequately covers the costs to provide PCA services. As many of you know, this has been a point of contention for many years between the department and the SEIU and other stakeholders. Next slide, please. Regarding the right sizing of behavioral health grants, this proposal reduces or eliminates certain behavioral health grants. The original reduction for this proposal was 6.3 million for the 22-23 and 2 million for 24-25. With this proposed change, the reductions will now total 1.8 million in 22 and 23 and neutral in 24-25, a significant reduction. Of the items on the original list to be reduced or cut, funding for adult mental health initiative grants is fully restored. Mental health first aid training and SUD recovery peer grants are refinanced with federal funds and maintained at their current levels for grantees. The only item that remains of the original list is the one-time transfer of 1 million from the lottery fund to the general fund. Next item. As it relates to realigning disability grants, a few changes are being proposed here. The first one is that with the previous reduction, changes were totaling about 8.9 million for the 22-23 biennium and an equal amount for the 24-25 biennium. That amount has now been reduced to 5.7 million in 22 and 23 and 1.6 million in 24-25. And this new level was achieved by doing a few things. The first one was that the reductions to family support and sales grants are now one time only, as opposed to being in both the 22-23 and 24-25 biennia. Funding for the innovation grants is fully restored, and savings from the reduction of state quality council grants is being reinvested in regional quality council grants and is a budget neutral adjustment. The proposal still does include the full reduction of the day training and habilitation grants on an ongoing basis. Next slide. We all know that homelessness is an ongoing crisis that impacts communities across the state. The previous budget proposal had a listed amount of 20.99 million as an investment in 22-23 and 21 million in 24-25. This proposal increases that investment to 21.3 million and 21.4 million in fiscal year 22-23 and 24-25 respectively. The original proposal included 2 FTEs. The change proposed here is to add an additional 2 FTEs to the housing division within the Department of Human Services to meet the higher than expected demand for housing stabilization services. And now I'll hand it over to my colleague, Dan Pollock.
Mr. Pollock, welcome to the committee.
Good evening, Mr. Chair and committee members. I will be brief. I know the hour is late. There is one small item at the end of the presentation here about change to nursing facility reassessments. This is actually a proposal that the chair himself authored in the 2020 session, which we appreciate. It really is a way to ensure that nursing home residents, when they are assessed for a need like therapy or isolation space, that the reimbursement for that need ends when the need ends, Right now, they're only reassessed every 90 days, once a quarter, and that can result in billing to Medicaid or a private pay person that is really unnecessary based on care that they didn't need and didn't receive. So this generates some savings on the Medicaid budget. The governor's supplemental budget reinvests those savings in 6 new forensic accountants and auditors, which I think we would all agree is timely and necessary given the complexity of what's happening with nursing home reimbursement right now between this and the CARES Act and the variety of COVID relief funds that have happened over the last year. And then there are 2 very small projects. One is complying with new federal requirements for assessing nursing home facilities resident care needs. That's basically a case mix redesign that's required by the federal government that we would work with the providers on. And then lastly, updating the costs of the consumer satisfaction surveys for nursing homes. Those are current law activities. The costs have not been updated since 2006. I am happy to take questions on this.
Thanks. So we'll take questions at the end, but Ms. Grom, are you still here to say something, or did they cover your stuff?
Mr. Chair, members, if you would like, I can provide an overview of the customized living provisions in the governor's budget.
Yeah, please.
All right. So thank you, Mr. Chair, members of the committee. For the record, my name is Christy Grom, and I'm with the Department of Human Services in the Community Supports Administration. Thank you for the chance to share the governor's proposals that deal with customized living today. I know this has been an area of particular interest of yours, Mr. Chair, and for other members on the committee as well. So we really do appreciate your partnership on this issue over the years. So first, before I delve into the proposals, I can provide some background information on customized living, just to kind of ground us in what the service is, and provide at least a basic understanding of some of the history of the service and how we got to where we are today. Apologies, I'm a little bit out of breath because I just had to corral my cat into a different space for the hearing, so.
That could be dangerous. I'm glad you're okay.
Yes.
Go ahead.
All right, so just to provide a little bit of an overview on customized living. Customized living is a home and community-based service for people with disabilities who use either the brain injury or the CADI, the Community Access Disability Inclusion waivers, as well as older adults on the elderly waiver. I want to note at the outset that customized living is a service that was initially developed to meet the health needs of older adults. And what we hear from our colleagues in continuing care is that it continues to work well for that population, given their particular support needs and where they're at in their life journey. But we found that it's not the best fit for most people with disabilities on the BI and CADI waivers. So to give you a picture of why that might be and what customized living looks like in practice, it might be helpful for members to think about a person you might know who lives in an assisted living facility. So customized living is essentially the service set that's offered in those settings. It's a menu of individualized, scheduled, largely medical or health interventions that a person gets when they live in a qualified setting. The nature of the service design lends itself more to a model of medical model of disability. So a model that tends to take, particularly for younger adults, a deficit-based approach, sometimes assuming that the disability is at the core of who a person is and their lives necessarily revolve around services and sometimes the often rigid schedule of services that the person may or may not prefer or need. So knowing that background, then how did we get to where we are today? So a little bit of history. Following the passage and the implementation of the corporate foster care moratorium in 2009, lead agencies, providers, sometimes families began looking for creative ways and different models to support people living in community settings. So there was a wave of service arrangements that were coming about post-corporate foster care moratorium that ended up being inconsistent across the state, essentially resulting in disparities to accessing services depending on where a person might have lived. In addition to the uniformity issues, the service arrangements in some cases were questionable in terms of what would be allowed under our federally funded home and community-based service waivers. So they created some compliance issues for us as well. Some of the compliance and uniformity issues were addressed administratively through working with our lead agencies in the support planning process, and others were addressed through the creation of what we call tiered standards for BI and CADI customized living. So what we mean when we say tiered standards is that the service has a higher standard for a new person that's authorized to receive the service as of a certain date. The new standards in this case are part of our approved transition plan with the Centers for Medicare and Medicaid Services that ensure compliance with the HCBS federal settings rule, specifically ensuring that settings that may have isolating features are indeed home and community based in practice and how the person experiences those services. So effectively, tiered standards means that as of January of this year, people on the BI and CADI waiver who are 55 and under and who want to live in a customized living like setting, in other words, an apartment that is provider controlled, will instead access the new service, integrated community supports. So integrated community supports is the new service that fills the niche that customized living used to in our service continuum. It's more focused on ensuring people have opportunities for integration. It offers more flexibility if that's what's preferred by the person. So earlier when I mentioned the medical model of disability, integrated community support starts to build on what we've learned from advocates and the disability movement and move toward a service design that's more aligned with the social model of disability, acknowledging that environmental and attitudinal barriers, not just the disability itself, are factors that could inhibit full integration in the community. I'm not an expert on the service itself, and we do have folks here that can answer questions, but so I won't go into depth on it. But one of the important things I want to note about this service is that it's a 245D licensed service, which is different than customized living. So we think this includes some important protections related to service termination and staff qualifications that are particularly tailored for people who use our disability waivers. So briefly, I can talk about the rate structure and some of the spending trends before I jump into the proposal. So most services available under the disability waivers have cost-based rates that are set by the disability waiver rate system. So as members know, we look at a variety of what we call cost components, things like administrative costs, staff wages and benefits, sometimes customization costs, depending on the person that's using the services, and use a calculation to build a rate that reasonably covers those costs. Customized living rates, on the other hand, are a little bit different. These rates are instead set by lead agencies, usually in communication with providers, when they enter a number of hours of different types of support into a customized living rate tool. So over the past several years, we've seen some increases in these hourly entries. So for example, authorized hours in the mental health category of supports increased by 118%, so approximately $40 million between fiscal years 2017 and 2019. And the increase in units combined with increased utilization have led to where we've seen the overall increased spending for BI and CADI in the past few forecast cycles. So moving then on to the governor's proposals related to customized living. We have two proposals related to customized living. The first is called Customized Living Program Integrity. And the next one is called Acuity-Based Customized Living and Closing the Corporate Foster Care Loophole. So Customized Living Program Integrity is a Blue Ribbon Commission proposal. It ensures the integrity of the support hours entered into the Customized Living Rate tool that we talked about just a bit ago. And it simply places a 24-hour limit of daily supports that may be entered into the tool for BI and CADI waiver recipients. So we'd program a limit into the system and that limit couldn't be surpassed. So it's a pretty common sense program integrity measure. In fiscal year 2019, about 2% of people who received BI and CADI customized living had a rate that included more than 24 hours of support per day. So whether those entries were probably made in error or for some other reason, we feel it's important to establish this, this cap and just ensure that you can't enter more hours than there are in the day. The second proposal related to customized living is our acuity-based customized living and closing the corporate foster care loophole. This proposal has two main fiscal impacts. The first aligns access to customized living services with the person's assessed support need. And the second establishes a moratorium for customized living settings that serve 4 or fewer people in single-family homes. So these modifications are really just ensuring that services are consistent with person-centered planning, and that we're supporting proper licensure of 4-person residential settings in customized living settings. So the first part of the proposal limits the amount of supports that would be authorized to people receiving customized living services under CADI and BI based on that person's support needs. So the way we developed this provision was We looked at average inputs for customized living rate calculations for CADI and BI and placed some parameters around rate tool inputs that appear to be, in some cases, misaligned with assessed support needs. The proposed limits in this proposal are no more than 2 hours of mental health supports per day for people that do not have any assessed behavioral health needs, no more than 4 hours of support per day for activities of daily living, which would be things like dressing or eating for people with low ADL needs, and then no more than 6 hours of ADL support per day for people with medium ADL needs. So when we looked at these, we went a little bit higher than the average, just wanting to make sure we weren't creating any unintended consequences. And just want to note that for people that do have an extraordinary need or for some reason do need more than these allotted hours, exceptions will still be in place. So providers and counties can work with the department to get an exception to make sure they've got enough funding to cover the cost of providing services for that person. And then the final part of this proposal is the limiting 4-person customized living setting. So this particular proposal limits new developments that serve 4 or fewer people on the CADI and BI waivers in a single family home. So under this proposal, these settings wouldn't be able to be enrolled to provide customized living services going forward. What we've found is that these types of customized living settings oftentimes meet the definition of corporate foster care settings. And we believe that they should be licensed accordingly to ensure compliance with the moratorium and the legislative intent behind it. So through the process of limiting growth of these settings for 4 or fewer people, we may also determine that pre-existing sites need to be licensed as a residential program. So the second part of this proposal is allowing for a transition for these sites just to make sure they can get that corporate foster care license by way of an exception to the licensing moratorium. Mr. Chair, I hope that's a helpful overview of our customized living proposals in the governor's budget. Happy to stand for questions. Thank you.
Thanks, that's really very interesting. And there's a savings, I believe? There's no, we didn't have a page on that one. You probably had the most complicated one of all, so that's how good you are. So do you know the savings, Ms. Crum?
Mr. Chair, I know the first proposal, the Blue Ribbon Commission proposal, I believe is a savings of 1.766 million in 22-23 and 7.6 million in 24-25. And I'm embarrassed to say I don't know the savings on the second proposal. It's intertwined with several other proposals, so I would have to bring that information back to you or defer to our fiscal staff on that. Apologies.
Well, that's fine for now. And I'm interested to read more about that in particular. So, we'll open up for questions, and I'll just start with Ms. Grom. Oh, Senator Utke, go ahead. You can have the first one. Nah, go ahead. You get the first question.
Okay.
That's a record.
Well, thank you, Mr. Chair, and I have a couple different questions, and I'm going back to the slides, and I'm going to go from the back forward. So Mr. Pollack is the one that talked about the nursing facilities, and one of the highlighted items was adding 6 new forensic accountants and auditors. How many do we currently have?
Mr. Pollack.
Mr. Chair, Senator Utke, I believe we're currently funded for 5 positions in that office.
Senator Utke.
Okay, thank you. So we've got 5, but we're looking to add 6, is what I'm seeing there. Okay, thank you. Then I'm going to, this is when we're talking about the background checks, which was slide number 6. And we've had a lot of discussions in the last couple months about this due to the backlog. But in what's proposed is the extension of 365 days, which we've discussed offline and such. But I think the biggest challenge is we only have one vendor. I see we're adding, would like to add temporary FTEs, but yet that vendor is the group that has to carry out the background checks. How does this even try to help catch up? It seems like we need to do more if we're going to get current.
Ms. Moti, is it? Is that your topic?
Yes, Mr. Chair, Senator Utke. It's the vendor does the actual fingerprinting of it, so that begins our process. Then the rest of the actual conducting of the background study and doing all of the checks, that is actually handled at DHS. So the fingerprint vendor actually does the digital print and it rolls that into the system and kicking off the process. And we are aware that we have one vendor, and we are currently finalizing our RFP process and looking at that. And part of that is discussing the additional 150 to 200,000 fingerprints that we anticipate that would be coming into the system, and also being able to handle that. So we are aware of that, and we're putting together a proposal and working with our vendor on how to address that.
Senator Rutke.
Thank you, Mr. Chair, and thank you, Ms. Motique. I know that's been part of our discussions, that it was going to take additional resources as far as additional vendors, and I'm glad that that's in the conversation so that we can catch up. And the last...
before you get there, Ms. Moti, are you considering additional vendors or just more staff in the department? I think you're limited to one vendor by law. Right?
Well, she did reference going out for RFP, so are you trying to secure either a second vendor? I know the current statute, I think, says one vendor. Is it a second vendor or a vendor that has more capacity?
Ms. Moti.
Thank you, Mr. Chair and Senator Utke. So we're addressing it. We will be having a new contract August 1st as part of our RFP. So we will be addressing it in the new contract. Because we're still in the RFP process and it's not made public yet, I can't speak to a lot more, but we will be having more details shortly that we will be able to share with the committee. But we know that there is going to be this increased volume, and so we're already beginning to prepare working with the vendor as to what that process would look like.
Well, Ms.
And being
Moti,
able to accommodate and handle all of the additional increase.
well, Ms. Moti, current law requires you to only have one vendor. Is that right?
We can contract with more than one vendor, but we aren't able to fully administer some of the financial impacts and the considerations that would be needed in a multi-vendor system. So what we would be asking for is to be able to have the correct contracting and appropriation languages so that if we needed to, we would be able to operate a multi-vendor system.
All right, well, that's, because I think the Senate bill is going to include more than one vendor, so, and I don't want to have you break all your secrets, but I just don't think you can do it with one, so I hope you can sort that out. So, Senator Rutke, the floor is yours.
Thank you, Mr. Chair. I just have one more comment, I guess, is more probably appropriate on this one, and that was going back to page number 3 of the slides, and that has to do with the overpayments to the two tribes and to some of our counties. And I know we've had bills here in this committee here previously, and what I'm seeing here, of course, is taking money from the general fund to basically go back and bail out the department. The department's already paid back the federal government for their portion of it. I just don't, in my opinion, this isn't the right way to approach it, that basically going back to our taxpayers for this round of clearing up something that you've already had you've shown that you've got the resources to cover it. This debt on the books should just be cleared up, and we'll move on to bigger and better things and learn from it. So that's just a comment. So thank you, Mr. Chair.
Thank you. Other members with questions? Okay. I have a couple. Commissioner, do you know what's the target for the bill? Like the net increase in general spending in the 22-23 and the 24-25? Do you know that offhand?
Not offhand. I wonder if Mr. Greenman's still with us. Actually, I think he's not. And Matt Burdick, do you happen to know the total?
Mr. Burdick.
Thank you, Mr. Chair. Matt Burdick with the Department of Human Services. I believe in the first biennium, the net over base is 211 million or thereabouts. I do not have the tails target, but we can get back to you.
Sure, that's helpful enough. And so, Commissioner, I don't know who knows this. Maybe Ms. Schlick or somebody, but is the $750 payment from TANF still in the governor's proposal?
Yes, it is.
Okay. Have you all looked at the impact of the $1,400 per person payments and the child grants?
The tax credits?
Well, no, there's cash.
The grants?
Yeah, there's grants. There's one of my people I know got $5,600 in the mail. They got it for the people and their kids. Have you considered the impact of that on the necessity of doing the $750?
Mr. Chair, Ms. Schlick and I were just discussing that this afternoon, trying to understand the implications and the overlap of the people who might be eligible for those stimulus checks for one, and the child tax credits for two, and then our MFIP services. And we have a lot of questions yet to ask other people who might be able to help us sort that out.
All right.
One of the things I know is that the tax credits and the incentive checks, this stimulus checks, come from the IRS. And unless the people on MFIP in Minnesota make themselves known to the IRS in Washington, they may not get those benefits. If they all do, then it's possible that people would be getting 3 benefits. That's true. So we've been trying to get to the bottom of that and understand that overlap.
Thank you. Appreciate that. I have some other questions, but other members have questions. I'll not hog the microphone. Seeing no more questions. So the PCA settlement or agreement, that's pretty good size. It seems like it's bigger. Is that include, Commissioner, I don't know if you know the answer, who you direct me to, but it's $68 million for the contract. And I have to say I'm personally happier trying to get those folks to $15 an hour of any particular group that I know of. But I know the issue in the past has been that this proposal underfunded the PCA choice, or that group, I believe that's the group. Is the reason this number is higher because it funds everybody somehow? Does somebody know that, Commissioner?
Is Gertrude still with us?
Ms. Mutemba Matassa?
Mr. Chair, I'll defer to Christy Grom or Natasha Merce.
Ms. Grom, yes. Oh, yeah. Hello, Ms. Grom.
Mr. Chair. Thank you, Mr. Chair. Christy Brown with the Department of Human Services. This particular proposal is higher in the governor's supplemental budget because it includes cost reporting. So essentially some administrative support for the department to be able to collect adequately what the costs are that all providers across all types, both PCA traditional and choice, are, so that as we look at future rate methodologies and collective bargaining agreements, we have a better sense of the amount of funding that would be needed in order for providers to be able to meet those terms of the collective bargaining agreement.
And how much is in there for the cost? Do you know?
I would have to defer to.
Is it a lot, or it can't be that much, can it?
No, Mr. Chair, I don't think it's too much, but I can defer to Ms. Bailey, who has those exact amounts at her fingertips typically.
Yeah, way to phone a friend. Ms. Bailey, they said you know.
Hello, Chair Abler, Elise Bailey, for the record, Fiscal Policy Director for the department. Could you repeat the question as far as like what particular components you are looking for?
Well, I had 2 questions on the PCA part. It's, I remember it's, of course, it's be higher for each biennium. There was a concern in the past that it did not give the providers enough to cover their costs if they had people that were below the then threshold of 1325, I believe it was. And so is there sufficient funds in there now to cover all the providers as well as the contract people?
Sure, Chair Abler. The program costs in this proposal relate to covering the bargaining agreement conditions for staff that are covered by the bargaining agreement. So kind of the issue in the past is that we can only have one rate across the whole PCA program, and not everyone is covered by the bargaining agreement. And so the changes in this proposal only fund the contract as far as the wage increases and the benefit increases for people covered by the bargaining agreement. So this updated supplemental budget doesn't include any increases to the rate to account for other PCA staff that aren't covered by the bargaining agreement.
So we're raising
This change was updated based on the February forecast, so there are different numbers in there than what you've seen previously. And then, as Ms. Graham said, it includes cost reporting for future rate development that could cover the whole program.
You've actually provoked a new question. So how do you propose to pay the extra buck to all the rest of the PCAs? So they're just going to take it out of their profits, or is there a plan for that?
Well, Mr. Chair, there could be a possibility for the legislature to appropriate a different rate methodology. I know there's been some bills in both the House and Senate to look at rate framework bills that would really set a methodology based on costs for the program. This proposal itself is just to cover the bargaining agreement, but it could be done in conjunction with other ideas such as that.
Right, so you're suggesting that the governor's proposal just kind of ignores the other group. Can you tell me offhand how big are the two different groups? How many people are covered by the contract and how many are not? Do you have any idea?
Mr. Chair, there's several different populations that are covered by the bargaining agreement.
But how many? Yeah, go ahead.
Yes. So one rate applies to the entire program. I believe about a quarter of the personal care assistants are covered by the bargaining agreement.
And so you understand my question. And so we're giving a raise, we're paying for a raise for 25% of the population, which I think is a great idea. And I think it's a great idea to give everybody a raise, but there's no proposal in the governor's budget to handle the three-quarters who are not part of that. But they're going to get that raise anyway, somehow. Have I got that right?
The cost of the bargaining agreement, the way that we estimate it out, we do it on an aggregate level because we can only pay one rate regardless of whether a PCA staff is covered by the bargaining agreement. And so all rates will get the increase. I think the issue is, looking forward to the future, having a rate methodology that is based on costs. And that is why the governor is requesting cost reporting so that we have some data to go off of in the future to really refine how we pay for these services and make sure that we have a data-based methodology to set it on.
And I'm not arguing with that. I'm just trying to understand. So it seems like maybe I'm just confusing you, which people say I'm capable of doing. So there's enough money in this. Yeah, Senator Aki in a second. I just want to mess this up a little longer and then you can clean it up. So there's enough money in this proposal to pay for the people in the bargaining unit, but not to cover the rate that we're going to pay everybody else that's not in the bargaining unit, which is by 3/4 of the remaining workers. Have I got that straight?
Mr. Chair, the bargaining agreement covers multiple services. So it will cover the Consumer-Directed Community Supports, CDCS, the CSG program, as well as PCA Choice. When it comes to PCA, there's another population that isn't covered by the bargaining agreement. When we calculate what the total cost will be for this agreement, we look at all the workers that are covered by the agreement and cost out how much would it cost to bring them up to the wage floor. And then we apply that total cost across the entire program.
So this does pay for giving everybody a raise in the whole program of all sorts, or is that what? Senator Aki, why don't you take a stab at it?
Thank you, Mr. Chair. I think you're heading in the right direction, and I'm going to do the same thing. Are all of the members that you just talked about, both from the bargaining group to the non and the PCAs and all the others that fall under this, are they all treated the same? Are they all going to get the same raise? And then we talk about the cost study. Again, would they all be treated the same, or are we going to bring in different costs because of the different groups?
Ms. Bailey.
Mr. Chair, Senator Uckey. So they are all treated the same as far as being paid the same rate. How we calculate what the actual rate increase will be, we can only utilize data from the bargaining agreement. So it's just the cost of bringing people covered by the bargaining agreement up. So it's not the same cost as if you were to pass a rate methodology bill that has a $15 minimum wage and all these other costs on top of it, like those bills have done. That would come to a higher rate increase.
Senator Uckey.
I'll take one more stab at this. Those covered by the bargaining agreement have a proposed increase of X. Are all of those, the other 75%, going to get the same increase? We'll call it the X. Or is, in the end, they're going to be different? That's all I'm trying to find out is, are we treating them all identical as far as if they're getting a dollar raise, do they all get a dollar raise, or are some getting $1.10 and some getting 90 cents?
Ms. Bailey.
Chair Abler, Senator Uckey. So what this will do is provide a rate floor for those covered by the bargaining agreement. So it wouldn't even necessarily require all people to have wage increases. What it does is bring up the floor. And so when we negotiate the SEAU contract, we're negotiating the conditions for people that are covered by the bargaining agreement. And that's kind of what it pays for. As far as whether a provider will apply those conditions to all of their employees, whether or not they're covered by the bargaining agreement, that would be up to the employer. What we do in the bargaining agreement is we're negotiating the agreement, not necessarily a rate for the Medicaid program. The rate is how we pay for the conditions, if that helps.
Senator Hoffman.
Thank you, Mr. Chair. As a follow-up, so the money set aside in the governor's budget is going to cover those that fit under the umbrella of this bargaining unit, but it does not address the folks that you had, the other 75% of folks that are not within that bargaining unit. So the governor's budget only budgeted for the increase to those that are covered under the bargaining unit.
Is that right?
Is that a correct statement?
Is that right, Ms. Bailey?
Senator Hoffman, Chair Abler, the whole program will get a rate increase, whether or not the PCA is covered by the bargaining agreement. However, the amount of the rate increase, how it was calculated, was based on the number of people covered by the bargaining agreement and the conditions that were agreed to.
So, Mr. Chair, so in a sense, like No Child Left Behind, this is no PCA left behind, right? So everybody's covered. The budget calculations address everybody. I don't need to go into the other weeds on it, the how. I think what I'm hearing from folks is, does that include everybody? And I think based on what you just said, the answer is yes.
But Ms. Bailey, is that increase for the 75% who are not part of the bargaining unit funded as a separate item in the governor's budget? I believe that answer is no.
No, it is, Mr. Chair?
No, they get a raise, but it has to come out of the provider.
Right, but I think, Mr. Chair, the CDCS folks are getting a smaller rate increase than the CSG PCA folks. That's a question to ask back.
Ms. Bailey, are we just, I don't think the question was that hard. It's
No, Mr. Chair, I do think it's complex, and I apologize for the complexity in it. I would say that the rate increase applies to everyone.
Yeah.
But how it is calculated, it isn't calculated as if everyone in the program gets a $15 minimum wage. That would be kind of a rate framework bill. I do see Commissioner Harpstead wanting to kind of say a few words, so I'll throw it to her.
Well, Commissioner, do you understand my question? I just want to know.
Yes,
Like
I
the-
think so. I think it's the same question I asked Gertrude Matemba Matassa earlier today. So I wonder
How did
if,
that go?
great. I wonder if our Assistant Commissioner would answer that question, please.
Ms. Butemba Matassa, welcome.
Thank you.
Welcome.
So I think the starting point should be, are we talking about a rate or are we talking about a wage? So when we establish a wage floor, we're establishing a wage floor for everyone across the system. Everyone is factored in. So by establishing a wage floor, we're saying this is what every employee in the PCA program across the board, whether they're CDCS, the whole span. This is what they should be receiving. But that's only binding, and my colleagues here can correct me, that's only binding to the providers that are covered under SEIU. That's the first part. So, as Elise correctly said, there isn't anything that mandates providers that are outside of that, outside of the bargaining unit, to offer that rate. So to offer that wage. And so the rate that DHS pays is based on covering the wage floor that DHS establishes. So there's a certain level, there's certain assumptions that DHS makes regarding, okay, if we set the wage for 2022 at $14 an hour, this is the rate that we should pay to make sure that it covers this wage floor. So I'm not sure that's helpful or not. The problem, I'm going to add this one last piece. The current problem is that the assumptions that we're using do not match the assumptions of the providers. The providers tell us that we're assuming lower costs than the actual. And so when we talk about the cost reporting, what that's going to do is to look at the entire system, any person who is providing PCA services, to say, how much does it really cost to provide this service? And then we can begin to negotiate and bargain based on actual numbers, as opposed to, kind of what we're doing right now, where we only have data from people that are represented in the union. I don't even know if I'm making it worse, better.
Well, I appreciate it. It's, and I'll try my question I had in the beginning on you. So the governor's proposal, so it's important to recognize that the governor actually pays for his proposal. He finds money from sources that he believes are a good idea, and he brings forward things he wants to buy, or whoever he is anyway. And so, but in the governor's proposal, there's $68 million put aside to cover this rate thing. If a provider who is not part of the bargaining unit wants to raise their employees' pay to the same number, I'm not clear if they have to or not, but if they do, is there additional funding coming to that provider as well to cover that rate increase, either through a natural artifact of the DWRS system, or is there, that's my question, or part of this? And I think the answer is they're on their own to figure out how to get that pay increase to their workers with their existing funds. Is that right?
Mr. Chair, so the way it works is that once a rate is established, that is the rate. And so I think therein lies the problem. This is the reason why when we determine that this rate covers this wage floor, providers are saying, they're telling us that what they want to do is to increase the wages so that they are livable wages. Their desire is really to increase the rate to a certain amount. But then their hands are kind of tied, because based on the wage floor that we've calculated and the rate that we've established, that's fixed. Right? We're not going to say, well, if you want to pay $17 an hour, we're going to change the rate for you. And so we're trying to overcome that by making sure that we are not underestimating how much it actually costs to provide these PCA services. We want to make sure that we're not unintentionally driving providers out of business because we don't have a clear understanding of how much it actually costs. And so our hope and goal is that once we have done this study of how much it actually costs, we're going to be able to be working off the same assumptions as providers so that we can adequately at least cover the wage floor that we establish with them when we bargain every year.
So if I know a provider who is not part of the bargaining unit and he has PCAs that she or she hires, are they going to call me and say, how am I going to afford to pay the extra buck? Am I going to get that call? That's another way to ask my question, Ms. Muthemba Matasa.
Mr. Chair, you might. You might, because we're hearing the same thing from providers right now. And that's the reason why we want to make sure that we're checking our assumptions. And the only way to check those assumptions is to make sure that we're using a consistent method. And that method has to include data from all the providers across the system, including those that are covered by under SEIU. And so, yes, you might get that. And we want to be able to get to a point where you will not be getting that anymore because we will have a good understanding of the numbers.
But this year, the people, the PCAs that are not part of the contract with all the related groups are going to get a raise. And the people who are not part of the contract are on their own to figure out how to make that work in their own organization. And there's no additional money in the governor's budget or in the rate setting anything to cover this increase of nominally $1. Is that right?
Mr. Chair, I don't know if I would be comfortable characterizing it that way. I mean, Ms. Bailey maybe or Ms. Grom can chime into that piece. I'm not comfortable addressing that piece.
Well, so it's going to take all the $68 million to cover the people in the bargaining unit. Is that right? Plus your cost reporting thing. I think I got that right. Is that? I'm sorry, this has got to be some of the worst TV to watch. I think ratings have plummeted, and I apologize. Anyway, so, yeah, who's there?
This is Jody
Oh,
Parkston.
Did it go better than this for you, or did you?
It did. My understanding of the proposal is it was the governor's intention and ours to cover the cost of this wage floor for all PCAs. And we believe it does. Some of the providers don't believe that it does.
Okay, so there's more money in here than it just takes to cover the contract people. There's an extra pot. Thank you. I'm gonna quit. This is awesome. And so the heroine takes the horse home and feeds it. Okay, I did have another couple of questions, so they won't be as hard as that. And I don't know who gets this one. Maybe as commissioner, since you're here, and that we had a conversation about the lottery money. And apparently you all think that they didn't need it, and the lottery people thought they did. And that's still in the governor's budget. And so my question is there discussions? Paul was here and we were chatting, and he seemed like he was going to have some conversations about what to do with that. Is that still ongoing? Do you know, Commissioner?
I don't know. Matt Burdick, do you know?
It was Mr. Fleissner. So Mr. Burdick, you were there for that discussion. Oh, Paul, Mr. Fleissner's here. Well, how about that? Hey, Paul. Hey, Mr. Fleissner. What do you know about PCAs? You know how I can explain that to us?
I used to work with them all the time, but I don't know much about that rate methodology.
I'd stay out of that if I were you.
Now I'm less than an expert. Chair Abler and members, Paul Fleissner with Behavioral Health Division. We are going to have follow-up discussions from the other hearing. What's happening right now is our finance people who are new, management people like me who are new, are trying to understand the flow of these dollars and the actual dollars that are available to talk with Ms. Tucker and move forward with good information. And so that'll be happening shortly.
I'm happy to hear, and I just want to help you understand that, you know, that it's been challenging for them to know their budget apparently. So I'll leave it at that. And I'm just happy to hear that. So I'm down to just a couple of questions and then a comment, and then other members can comment. So on page 15, you're taking you're reflecting underspending in the 22-23 biennium. Is that based on the end of the 21 biennium? The calendar 21? Who knows that? Like the 5.7 in savings under the one-time underspending thing. Who knows that? Ms. Grom, Ms. Burdick, Mr. Butembo Matassa, whoever.
Oh, Matt Burdick, do you know if that was in DCT? Is that in DCT? Can you see?
No, it's family support grants and SILs.
Oh, okay.
So, Mr. Burdick, who should I ask? Ms. Grom?
Ms. Grom can answer that question.
All right, thanks. You can tell it's getting late. We're just about done, so you guys can go outside. Ms. Grom, do you know, is that at the calendar, the fiscal year 21 ending, that those are going to be left over, like the old basic sliding fee underspending that we would capture? Do you know that? The 5.7 million on page 15.
Mr. Chair, I don't believe that's left over from 2021, but there was some underspending in family support grant and SILs. And so I believe we calculated that reduction in those grants based on the historic underspending to ensure that current levels would be able to be maintained for people who do use those services.
All right, thank you. And so do you know offhand, I'm curious, I'll let you take this home. I'm not going to tie it into the PCA program. But so do you have an idea what the budget, what the status is going to be at the end of calendar 21, the 2021 budget cycle? So that's my question. And I just want to offer a thought that I don't know how you'd know what future underspending will be except based on historic numbers. So I'm not going to ask more than that. So I'm just curious, the end of calendar year fiscal 21, what those are, please. And that's homework assignment, so thank you. Commissioner, I just wanted to point out a couple of the notes that people sent that I think would, I know what you've been trying to accomplish there, and I just commend you for your great success. I would encourage you to look at some of the comments on the foster care providers. There was one from someone named Philippiak from Oak Hill. On the front page, they just talked about, this is interesting to me, on the DWRS framework, consistency is lacking. Counties often calculate in a variety of ways. Each county thinks they're right. It's confusing for the provider and case managers who don't understand the system. This is a legacy system by now with DWRS after 7 or 8 years. And, you know, you've heard my concerns about the menu, and just that's kind of interesting to know. And there's some other comments from the foster care people, and they just somehow, one didn't feel included in the conversation, and another person could not figure out the manuals. And Ms. Fairchild says that I'm an intelligent person and have looked at the manuals and forms and can't understand what they ask. I shouldn't have to hire a company to complete the paperwork. So those are just some interesting things. Just feedback that they would have testified out loud if they would have been here. And I don't see them as horrible negatives. I just see them as useful information to just know how the discussion goes. And I've never been the head of a department as large as yours. And don't know that I ever want to be, frankly. But I do know that it's been your intention to have tremendous feedback and engagement with the community. And so there aren't, it's just a handful of people that thought that they would be included better. But I think the questions about the complexity are important. I've been talking about complexity for 22 years. We talked about the 5-page re-upping thing for SNAP or whatever for supports of some kind. Anyway, so, Commissioner, I appreciate all your work, and there's just a lot of great evidence of some of the successes. Case in point being the Family First dialogue, and the people who came tonight, they worked very hard to try to communicate with me, and hope you enjoyed the discussion about the PCA. That's just, we should do a meme. That's gonna be just funny. 15 minutes of people asking questions. Senator Hoffman, did you have any other questions?
Mr. Chair, I don't know. You start to bring me some post-traumatic stress in 2013 when you were a House member and we were freshmen, and we picked up that DWRS conversation and saw early on that it was going to have some concerns going forward. And I'm glad you brought up the notes, and I would have people go back and read these, because, you know, when you see a statement that says the DWRS rates don't align with a person's support needs, that's not a person's anecdotal statement. That's something they pulled from the report that was done in 2020. So I was going to say, you know, if we would do it all over again, what would we do different? And it's like, well, we can't do anything different. We just have to make sure that whatever we do forward, the system is, again, aligning with the unique needs of individuals and not us trying to shove people into a system that isn't flexible. And so the other thing is, what the other hard thing to read was, here's somebody who can't even, at the end of all the day, they have $8 left to their name every month, and that doesn't even address their MAEPD. And it's like, so I think, members, you might want to take a look at these, and I do want to thank you, Senator Abler, for your continued. I laugh because I watched you years ago when you were the House person, and, you know, getting deep into the weeds on this stuff is something we all need to be doing. But you set aside any differences and you just focus on what's right for people within the system. And I think today was a hard conversation, but a great conversation. So thank you for doing that.
Any other questions from members? Not to monopolize it all. So we'll bring this in for a landing, I think. And Commissioner, you weren't here, I don't think, for some of this afternoon's conversations about the waiver reimagined and the advancements and, you know, things that are really good on the mission statement level. But I just want to, you know, the governor was not afraid to put a pause on businesses when he was concerned that harm might happen to people. And I'm not persuaded that the waiver reimagined package is ready to go forward at its current pace. Especially with this, I wasn't expecting the DWRS comment, and what I just suspected that there's a great deal of county variation. I know for a fact there's a great deal of county variation on the min choices as that's implemented, and it's not for bad intent, it's just it's complicated. And I appreciate that your staff is working on the menu issues about the sleep staff and the complex need folks that I wish your consultant would have anticipated. And so those are the concerns I have. And so what saved the system to this point has been county flexibility, where they could look at individuals. What was that woman's name? Diane? Why don't you tell that story, then we're going to wrap it up.
Mr. Chair, the county case, she was a caseworker from Hennepin County. Her name was Diane Dodge, and she would look at the unique and individualized needs of somebody, and she would make their service agreement fit their needs, right? And it was just absolutely, in my mind from this afternoon when you brought that up. So I wish we could go back to that way. No, we just need to find more Diane Dodges.
Well, the world has changed. I mean, the accountability and all that, but at the end, you know, everybody on this screen here that has a little box cares about the people. And so do we, and so how are we going to handle all that? We got some hard discussions to have, and I don't think we could be in better hands than the commissioner that we have and the staff who's going to be there for us. So, Commissioner, do you want to say anything? You don't have to. I'm just glad to see you again. So thanks.
Chair Abler, just thank you for your feedback here just now and for the time tonight. We appreciate it.
Yeah. So this is our last minute of being in regular committee. And just to remind people if they haven't heard, we're going to be hopefully unveiling an amendment on the Monday after Easter, which is the 5th. And if we're lucky, we'll have testimony on Tuesday, the 6th, and then we'll mark it up on the 8th. Either way, we're marking it up on the 8th with whatever format it's in. It may be compressed, and we may have to do something on Wednesday if it's not ready. But we'll do our best. And actually, then So if it comes out on Wednesday, we'll present it on Thursday afternoon and have testimony and then work a long night to get done. So with that, members, thank you, and thanks, Ms. Johnson. You've been remarkable with our work. And Mr. Cotter and Mr. Brennan, and I shouldn't have started, Mr. Monahan and Mr. Hauswald. I'm sure you're watching this at home. I bet not. I hope not. And to the commissioner and her crew, thank you. We're adjourned. I